Hello.
Currently you are live, so go for.
Now I am in live. Live.
Yes, sir, you are live.
Okay.
Go and explain it.
मतलब वो यहाँ नहीं दिख रहा है.
No, सर, अब दिख रहा है. देखिए, लाइव स्ट्रीम हो रहा है सर आपका.
ओके. मैं स्ट्रीमिंग स्टार्ट हुआ था. ठीक है.
यस, स्ट्रीमिंग स्टार्ट है, देखिए.
ओके 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 ओके. यस यस यस.
So you just mentioned that you want to learn Python. So do not learn Python in manual way in 2027 because learning Python in manual way will take you like 6 months of your time. On top of that, you'll be fired.
Hello dear students. Very good evening. Welcome to our GDC English classes and welcome to our GDC weekly test explanation. So thanks for waiting. So sorry for little bit delay because of some technical issues. But I hope I feel everything goes well and we will continue smoothly and start our discussion regarding our you already gone through your GDC weekly test. Now it's time for discussion and you know that GDC English classes is giving coaching for GPAT, NIPER, drug inspector, pharmacist, especially in the English language, mainly for the benefit of South Indian region students. Okay, so let's have a discussion of our MCQs with explanation. So go for the first MCQ. So here, this is the first MCQ. So following are the three statements. So these are the following are the three statements regarding serotonin antagonist. Statement 1, ketanserin is a serotonin type 2 receptor antagonist. Statement 2, risperidone is a non-selective antagonist. Statement 3, ondansetron is a serotonin type 2 antagonist. Okay, so here are the options. So if you simply observe, Statement 3, ondansetron is a serotonin type 2 receptor antagonist. Ondansetron, granisetron are the drugs. They selectively block type 3 serotonin receptors and helps in treatment of vomiting, helps in preventing the vomiting. So definitely statement 3 is wrong. And risperidone is a non-selective antagonist and statement 1, ketanserin is a serotonin 2 antagonist. If you observe, so statement 1 is correct. So ketanserin is a serotonin type 2 antagonist and but statement 2 and 3 are incorrect. Risperidone is a not a non-selective antagonist. And statement 3, ondansetron, granisetron are their selective serotonin type 3 antagonist. So answer is simply option C is the answer. So option C, statement 1 correct, 2 and 3 are incorrect. So this is regarding explanation. So non-selective antagonist, partial agonist or antagonist, these are the example. Serotonin type 2 antagonist, these are the examples. And serotonin type 3 antagonist. All serotonin type 3 receptor antagonist helps in preventing vomiting. Next, coming to the second, bromhexine, ambroxol or comes under the category of pharyngeal demulcents, secretion enhancer, mucolytics, antitussives. So antitussives generally codeine and mucolytics, bromhexine, ambroxol are mucolytics. So there are other secretion enhancers and pharyngeal demulcents. So bromhexine, ambroxol both are comes under the category of mucolytics. Especially they increase the breakdown of mucus and make thick mucus to the thin mucus to easily evacuate from the mouth to outside of the body. Answer is simply option C, mucolytic. So this is the classification of drugs in treatment of cough. Next, which antihistaminic is a cough center suppressants like chlorpheniramine, 𝙂𝙀𝙬𝙬, 𝙤𝙀𝙬𝙬, Prenox, diazine. So among this category, our chlorpheniramine is regarded as a antihistamine which having the effect like it can suppress the cough. It can suppress the cough. So answer is very simple. That is chlorpheniramine is the answer. Okay. And this is regarding explanation. Again, drugs for treatment of cough and here antihistamines. Okay, antihistamines like chlorpheniramine, diphenhydramine, promethazine. These three are the antihistamines. They can suppress the cough center, and especially these three drugs are comes under first generation H1 receptor blockers. First generation H1 receptor blockers. Okay, I'm going for the next MCQ. That is fourth one. Regarding the fourth one. So following are the two statements regarding drugs used in treatment of asthma. Statement 1, omalizumab is an anti-IgE antibody. Statement 2, sodium chromoglycate or beta-2 sympathomimetic. The simple logic, yes, you know that already omalizumab is a monoclonal antibody. It is acts against IgE antibody, especially in treatment of allergic induced asthma. And coming to statement 2, sodium chromoglycate is not a beta-2 sympathomimetic. It is a mast cell stabilizer. So easily you can give the answer. So you can observe statement 1 is correct, statement 2. So option C is like statement 1 is correct, but statement 2 is incorrect. The simple thing. One is correct and other statement is wrong. The answer is simply option C. So this is a classification of drugs in treatment of bronchial asthma. Mast cell stabilizers. They are sodium chromoglycate as well as ketotifen. Both are mast cell stabilizers. Next. Match the following. Next question is the match the following. Okay. Regarding match the following. So theophylline, ketotifen, montelukast, prednisolone. So theophylline is a bronchodilator. Ketotifen is like a mast cell stabilizer. Montelukast, leukotriene antagonist. Prednisone simply corticosteroid. So the matching is very easy if you have the basics. And remember montelukast. So leukotriene antagonist. Montelukast, jaffrelukast, pranlukast. So montelukast, jaffrelukast, and pranlukast. These are leukotriene antagonists. So according to this, the answer is option B. That is 1R, 2P, and 3S and 4Q. The answer is very simple if you have the basic knowledge. So this is again classification of our drugs for treatment of bronchial asthma. Next question. So this is also one of the basic question. 𝘂𝐿IDIN as well as PAF, platelet activating factor, belongs to which class of AUTACOIDS? So simply amines lipids, cytokines, peptides lipids, cytokines amine. 𝘂𝐿IDIN is a peptide, platelet activating factor is a lipid. So based on that you can easily giving the answer. That is option C, peptide, 𝘂𝐿IDIN, PAF, platelet activating factor, that is a lipid. So platelet activating factor promotes aggregation of platelets and promotes clot formation. So this is the classification of AUTACOIDS. AUTACOIDS nothing but local hormones. They are also known as local hormones. Next. So read the following statement regarding AUTACOIDS. AUTACOID is derived from the Greek word which means self-healing, also known as local hormones. That is true. Histamine and 5-hydroxytryptamine amine derivative AUTACOIDs, yes, that is correct. Leukotriene is a amine derivative. Leukotriene is not amine derivative. Bradykinin is a type of peptide autacoid. Yes, definitely bradykinin is a peptide autacoid. So simply you can observe. So PQS. Yes, first one is correct. Autacoids are local hormones. Their meaning is simply self-healing. And histamine, 5-hydroxytryptamine amines. Leukotriene is a lipid. It's not an amine. And bradykinin is a peptide. Yes, that is correct. So PQS are correct, but R is incorrect. R is leukotrienes are not amines. Leukotrienes are peptides. So that is option A is the correct answer. So this is explanation. Again, classification of autacoids based on amines, lipids, peptides, etc. Okay. Next. So next MCQ. Which of the following statement correct regarding histamine? Decreases heart rate and force of contraction. Histamine causes decrease in gastric secretion. When histamine injected, then itching occurs. It penetrates the blood-brain barrier. Okay. So if you observe, when histamine injected, it can cause itching. Generally, excess levels of histamine in the blood may produce allergic reaction, may lead to itching. So here, it penetrates the blood-brain barrier. No. Histamine cause decrease in gastric secretion. No. Histamine increases gastric secretion through H2 receptor. That's why H2 receptor blockers like ranitidine helps in treatment of peptic ulcer. Okay. So the simple answer is option D. Only R is correct. Remaining 3 are incorrect. So this is regarding the functions of our histamine on different locations of the body. Next MC. So here, blockade of both dopamine type 2 and serotonin 2A or 2C receptor is a distinctive feature of pimozide, haloperidol, ketanserin, clozapine. So clozapine is one of the commonly used the second generation antipsychotic. It can block dopamine receptors as well as serotonin receptor. And clozapine helps in treatment of both positive as well as negative symptoms of psychosis. Psychosis is also known as schizophrenia, and antipsychotics are also known as major tranquilizers. So the answer is very simple for this question. Clozapine can block both type 2 dopamine as well as serotonin 2A or 2C receptor to help in treatment of psychosis or also known as schizophrenia. Okay, this is regarding the explanation of clozapine. Next. So regarding the next MCQ, match the following. Match the following histaminic receptors with their location in the body: H1, H2, H3, H4. For example, generally you can observe H1, H2, H3 receptors. So all histamine receptors are belongs to the G protein coupled receptors. So if you understand simply, H3 is generally regarded as a presynaptic, and H4 is generally goes to the eosinophils, neutrophils, and H1 is goes to the smooth muscles, endothelium, lungs, blood vessels, as well as gut brain, and H2 stomach. Especially excess function of H2 receptors in the stomach increases gastric secretion and may lead to peptic ulcer also. So simply answer is A, that is P. P is 3. H1 smooth muscle endothelium lungs, and Q1. Q1 H2 is nothing but stomach S, and R4 H3 presynaptic in nature, nothing but H3 receptors are autoreceptors. When coming to H4, they belong to immune system, eosinophils, neutrophils, as well as the basophils. So the answer for this MCQ is option A. So all histamine receptors are belong to G protein coupled receptors. Next question is here. The following serotonergic receptor functions primarily as an autoreceptor on neurons, like serotonin type 1, serotonin type 2A, serotonin type 3, serotonin type 4. So there are 7 types of serotonin receptors. Among that, serotonin type 3 belongs to ion channel inotropic receptor. Remaining all are G protein coupled receptors. Here question is about which of the following is a autoreceptor. Generally, Serotonin type 1 again having different subtypes like 1A, 1B, 1C, 1D, 1E, 1F. So serotonin type 1 receptors are autoreceptor. What is autoreceptor? Autoreceptor is also known as presynaptic receptor. When these autoreceptors are activated, they inhibit their own release of neurotransmitter. So answer is option A, serotonin type 1A. So serotonin type 1A autoreceptors because they couple to inactive G protein. When there is an activation of inactive G protein like G0, there is a decrease in adenyl cyclase, decrease in the secondary messenger, decrease the secondary messengers, decrease of pharmacological action, indication of decreased release of neurotransmitter. Okay. Next. So this is 12th. Next one. Read the statement which are correct regarding serotonin. Serotonin stimulates gastric secretion. Serotonin constricts bronchi but less potent than histamine. It stimulates effect on central nervous system. Serotonin tend to activate afferent nerve ending, causes tingling as well as pricking sensation. So generally you can observe serotonin does not involve in gastric acid secretion as well as serotonin does not having stimulatory effect on the central nervous system. But serotonin can constrict bronchi but less compared to histamine. Serotonin, histamine both are having stimulatory effect on the bronchi, but histamine having more potent nature to stimulate bronchi. Okay, so simply according to that, option A is the answer. So what is option A? Simply Q and S are correct. P and R incorrect. So P are incorrect. Remaining two are correct. So go through this. So CVS different locations and functions of the serotonin, effect of the serotonin. So if you observe, mostly here I mentioned reference regarding where we are taking this answer from where. Next, 13th question. Select the type 1 type nothing but H1 antihistaminic which is used topically in the nose for allergic rhinitis. So select the H1 antihistaminic which is used topically in the nose for allergic rhinitis. So rhinitis nothing but running nose because of allergy. So running nose, increasing secretion from the nose. Loratadine, cetirizine, fexofenadine, 𝙂�ㄎ. Okay. So here the answer is simply 𝙂�ㄎ. So 𝙂�ㄎ helps in this condition to control allergic rhinitis by blocking H1 receptors. Answer is 𝙂𝙬. So this is regarding the explanation. So 𝙂𝙬 and its action. Next. So here Shyam was prescribed a first generation H1 antihistaminic drug. He should be advised to avoid driving motor vehicles, consuming processing cheese, strenuous physical exercise. So simple logic, you know that H1 receptor blockers can easily cross the blood-brain barrier and they may produce sedation as well as drowsiness. During that condition, he should not go for driving any vehicles like motor vehicles. So the simple answer is option A. Okay, option A is the answer. So this is regarding explanation. That's why second generation H1 receptor blockers are safer than first generation H1 receptor blockers because second generation unable to cross the blood-brain barrier, no drawback of sedation as well as drowsiness. Next question. Okay, so read the following statements regarding NSAIDs, that means non-steroidal anti-inflammatory drugs. Steroidal anti-inflammatory drugs are glucocorticoids, they are steroids, and here aspirin, naproxen, these are list of drugs, they are non-steroidal anti-inflammatory drugs. Okay, so here first ibuprofen is rated as a safest traditional NSAID. Naproxen is an anti-inflammatory activity, strong anti-inflammatory. Nabutamin prodrug generates active metabolite 6-methoxynaphthalacetic acid. Nimsalide is a strong inhibitor of prostaglandin synthesis. So especially here, coming to simply, Nimsalide is not a strong inhibitor of prostaglandin synthesis, and remaining nabutamin is a prodrug, naproxen is anti-inflammatory, and ibuprofen is also safest traditional NSAID. So according to our explanation, the answer is simply option D. R, Q, P are correct. S is incorrect. So Nimsalide is not a strong inhibitor of prostaglandin synthesis. So this is here a discussion regarding ibuprofen, naproxen, nabutamin as well as a Nimsalide. Next MCQ. So read the following statements regarding prostaglandins. Prostaglandins also one of the AUTACOIDs. Prostaglandins also one of the AUTACOID. Okay. Here, read the following statement regarding prostaglandin. COX pathway generates eicosanoids with ring-like structure. Prostaglandins are products of long-chain fatty acids. Prostaglandins are C20 prostanoic acid, nothing but arachidonic acid. Prostaglandins may be considered to be derivative of prostanoic acid. So here all statements are correct. So COX generates eicosanoids. Eicosanoids like there is a platelet activating factor, there is a prostaglandins, there are examples including leukotrienes. So leukotrienes, thromboxane, prostaglandins are eicosanoids. So all the statements here are correct. That's why option D is correct answer. Option D is the correct answer. So here itself, at the question itself only the answer is mentioned. So that is a small mistake here. And this is the explanation. Next. Choose the correct statement about sumatriptan. It activates type 1A serotonin receptor, tended to suppress both pain and vomiting in migraine. It does not carry the risk of precipitating coronary vasospasm. It is combined with ergotamine for treatment of severe migraine. So choose the correct statement about sumatriptan. So regarding here, it tends to suppress both pain and vomiting in the migraine treatment. Sumatriptan, like all triptans, they helps in treatment of migraine. Especially in the migraine, what they are doing, suppress both pain and vomiting in the migraine case. Answer is option B. So this is regarding the explanation of triptans. All triptans are selectively serotonin type 1B or 1D receptor agonist. Sorry for inconvenience. So they are selective 1B or 1D serotonin receptor agonist, like sumatriptan, rizatriptan, naratriptan, 𝘿𝙄triptan, all triptans. Next question. So what is the next question? What does wheel refer to with respect to the triple response by the histamine? You know that there is a triple response observed in case of histamine. So in that, what is the meaning of wheel? 𝘿𝙄𝙎𝑎𝑙. So intense capillary dilation, redness in the surrounding area, and edema due to exudation of fluid from the capillaries as well as venules, heat in the surrounding areas. Generally, wheel nothing but edema due to, redness in the surrounding area. Edema due to the exudation of fluid from the capillaries as well as venules. Sorry for inconvenience. Answer is option C. Edema is nothing but accumulation of fluids at particular area due to enlargement of capillaries. Answer is option C. So generally the key three characteristic features like red spot, flare, wheel are three signs observed when there is an injection of histamine into the body. Next question. So regarding the next MCQ, selective serotonin type 1B or 1D receptor agonist useful in acute migraine. So buspirone, ondansetron, proatriptan, ketanserin. If you observe clearly, all triptans like sumatriptan, naratriptan, zolmitriptan as well as proatriptan, these helps in treatment of migraine by agonizing serotonin type 1B or 1D receptor agonist. So remember, triptans, all triptans are serotonin type 1B or 1D receptor agonist, helps in the treatment of migraine. Answer is proatriptan. All triptans are selectively agonize the serotonin type 1B or 1D receptors and helps in the treatment of migraine. So these are all triptans: proatriptan, zolmitriptan, sumatriptan, rizatriptan, naratriptan. Next question. 𝘿𝙄𝙎𝙎 relieves migraine by. So blocking vascular alpha-adrenergic receptors, blocking vascular serotonin 2 receptors, dilating cranial arteriovenous shunt channels, constricting cranial vessels and reducing perivascular neurogenic inflammation. So constrict the cranial blood vessel, increases blood flow to the brain area which is affecting by the migraine, as well as reduces perivascular neurogenic inflammation, reduce the inflammation in the migraine. So simply option D is the correct answer regarding 𝘿𝙄𝙎𝙎 action in the relieving of migraine, helps in treatment of migraine, option D. So these are the ergot preparations like 𝘿𝙄𝙎𝙎, so helps in treatment of a migraine treatment. Next question. So next question is, read the following. Read the following statement regarding eicosanoids and platelet activating factors. So first one, leukotriene C4 is generated through the lipoxygenase pathway. Yes, leukotrienes are generated by lipoxygenase pathway with help of lipoxygenase enzyme. Regarding COX is isoenzyme COX1, COX2 differ from each other that COX2 is a constitutive while COX1 is largely inducible. COX1 is constitutive in GIT, protects from the peptic ulcer. COX2 is inducible in inflammation as well as in pain. COX2 enzyme is inducible, COX1 is a constitutive. Thromboxane A2 is a potent inducer of platelet aggregation. Prolonged airway hyperactivity is characteristically caused by the histamine. So simply you can observe here Q is wrong as well as S is also wrong. P and R are correct. Leukotrienes are through the lipoxygenase pathway and thromboxane can be potent inducer of platelet aggregation. Thromboxane, it is nothing but helps in formation of thrombus, clot formation. So answer is very simple. That is R, P are correct. S and Q are incorrect. Okay, this is regarding the explanation. Next, prostaglandins play pathological role, pathophysiological role in the following except patency of ductus arteriosus, regulation of renal tubular salt absorption, ventricular remodeling after myocardial infarction, as well as initiation of labor. So among this, prostaglandins participating in all these conditions, the exception will goes to which one? The exception will goes to the ventricular remodeling after myocardial infarction is not a part of pathophysiological role of prostaglandins. Prostaglandins is a type of AUTACOIDs having many roles in the body. These are the functions, biological roles of prostaglandins in the body. Next question. Flush, flare, well are associated with the injection of which of the drug? 𝘿𝙄𝙎𝙎𝙎, 𝘿𝙄𝙎, atropine, histamine. This is very, very simple. So before we already gone through one MCQs, 𝘿𝙄𝙎 is a part of histamine. VL is nothing but edema, nothing but accumulation of fluids at particular part of the body due to excess histamine action. And these are the three characteristic signs observed after injection of histamine into the skin. Answer is histamine. Okay, this is a discussion regarding the histamine and its effect on the skin as well as blood vessels. Next, first generation H1 receptor antagonist differ from second generation in that first generation have anticholinergic effect S, first generation H1 antihistaminic cause sedation S, first generation H1 antihistaminic can cause blood-brain barrier. Yes, first generation can cross blood-brain barrier, because of that they can produce sedation. First generation H1 blockers can having anticholinergic effect. All these are correct. Coming to second generation H1 blockers, they are unable to cross blood-brain barrier, no sedation or drowsiness. They cannot block the muscarinic receptor, nothing but they don't have anticholinergic effect. Compared to H1 receptor first generation, second generation are safest drugs. The answer is very simple. All are correct. All is the correct. Next question. So this is the difference between first and second generation of H1 as well as H2 receptor blockers. Next question. Which of the following statement is incorrect for serotonin type 2? Plays major role in the regulation of GA motility, promotes aggregation of platelets, deactivates cerebral neurons. It is coupled to GQ protein and activate phospholipase C. Which one is incorrect regarding serotonin type 2? Generally, it involves in activation of cerebral neurons. So this is the wrong answer. Yes, it plays a key role in the regulation of GA motility and promote the aggregation of platelets, coupled to GQ protein and activate the phospholipase C pathway. Answer is very simple. That is incorrect one is option C. So these are the functions of our serotonin type 2 receptors by coupling to the GQ protein, one of the active G protein couple receptor protein. Next. So these are 7 different serotonin receptor subtypes. Which receptors found in the GIT gastrointestinal tract? Serotonin type 4, serotonin type 3, serotonin 7, serotonin 2. So serotonin 3 is mainly present in the vomiting center, and stimulation of serotonin type 3 produce severe vomiting. That's why serotonin type 3 receptor blockers like ondansetron prevents vomiting, and serotonin type 4 majorly present in the GIT gastrointestinal tract. Stimulation of serotonin type 4 increase the gastric motility. So simply the answer is the receptor found in the GIT among the serotonin receptors is serotonin type 4, and this is regarding location of serotonin 1, 2, 3, 4 as well as remaining receptors. All are G protein coupled receptor except serotonin type 3. Serotonin type 3 belongs to ion channel or inotropic receptors. Okay, next question. Ketanserin, granisetron, respectively. So serotonin 1B antagonist, serotonin 2 antagonist. So here you can simply remember cetrons, granisetron, ramisetron. There are different cetrons. All cetrons are serotonin type 3 antagonists. So here granisetron is a serotonin type 3 antagonist. Serotonin type 3 antagonist is present in option B. So ketanserin, serotonin 2A antagonist. Ketanserin is a antihypertensive, and granisetron serotonin type 3 antagonist, that is a anti-emetic. So option B is the correct answer. So yes, you are going through the basics, you are going through the knowledge. Sometimes our brain work also important. Okay, our typical thinking is also important. So here clearly serotonin type 3 blocker is granisetron. So here the explanation. So agonist, antagonist on the serotonin along with the different types of receptors like serotonin 1, 2, 3, 4, agonist as well as antagonist along with their applications also. So you know that the main mode of our explanation is to understand MCQ with clear answer. So next question. Match the histamine receptors with the correct primary signaling mechanism. Match the histamine receptor with correct signaling. So generally, if you go through the H1 receptor, increasing calcium, increasing nitric oxide cyclic GMP. H2 receptors linked with increasing cyclic KMP. Increasing cyclic KMP through H2 increase excess acid production. And H3 receptor is autoreceptor linked with a decreased cyclic KMP, and H4 receptor linked with chemotaxis and cytokine secretion. That is H4 receptors are interlinked with the immune system. H3 receptors are autoreceptor. H2 receptor increases cyclic AMP. H1 receptor increase calcium, increase nitric oxide, increase cyclic GMP. So increasing cyclic guanosine monophosphate, increasing guanyl cyclase, increase nitric oxide. Nitric oxide is a vasodilator on the blood vessel. It causes vasodilation of blood vessel. So the simple answer is option A. Option A. So that is P3Q2R1 as well as the S4. So this is a simple match. So this is the explanation of H1, H2, H3 receptors, their locations as well as their functions along with their respective drugs. Next question. Histamine is stored in the mast cells because it binds to acidic proteins and heparin within granules. It cannot be synthesized in the body. It is a lipid soluble. It is resistant to metabolic degradation. The simple thing is it binds to acidic proteins and heparin within the granules. Heparin within the mast cell granules. Okay. I think it is fine. Everything is going okay. So the answer is simply option A. Okay. And next question. Regarding the next question, sorry. Histamine. Histamine is inactive when administered orally because cause severe toxicity in stomach. It not absorbed from the intestine. It rapidly digested by the metabolic process. Does not act on any receptors on the GIT. Simple logic. If for example some drug is taken to the oral route, definitely the major reason is behind first pass metabolism. So that is rapidly destroyed by the metabolic process. Simply first pass metabolism. Answer is option C. And this is the explanation. Next. Match the enzyme with correct drug. So COX-1. So here not drug. So for example, COX-1 is involved in the constitutive gastric protection. And COX-2 is inducible in inflammation as well as pain. And paracetamol selectively inhibit the, COX-3. COX-3 is selectively inhibited by the paracetamol. And paracetamol is a drug analgesic and antipyretic in nature. So COX-1 enzyme constitutive host protective role in the GIT, helps in treatment of a peptic ulcer. COX-2 is inducible during the inflammation and pain. COX-2 enzyme levels are more. And coming to paracetamol, paracetamol is an analgesic antipyretic. It does not have an anti-inflammatory effect. And COX-3 enzyme selectively inhibited by the paracetamol. Paracetamol selectively inhibits cyclooxygenase 3 enzyme in the hypothalamus and reduce the prostaglandins and helps in treatment of fever. Paracetamol helps in treatment of fever by inhibiting COX-3 enzyme in the hypothalamus. Okay. So simply COX-1, that is involved in the constitutive action. COX-2 inducible. Paracetamol analgesic anti-inflammatory. And COX-3 selectively inhibited by the paracetamol. This is regarding the explanation. Next. Platelet activating factor is best described as a peptide mediator derived from the mast cells, a polar lipid derived from the membrane phospholipids, a neutral lipid derived from the adipocytes, a glycoprotein mediator released from the hepatocyte. The simple logic, platelet activating factor is a lipid. Platelet activating factor PAF is a lipid, a polar lipid derived from the membrane phospholipids. That is option C is the, option B is the correct answer. And this is regarding the platelet activating factor. Next. Leukotriene receptor type 1 and type 2 are coupled with which G protein? G-alpha-S, G-alpha-I, G-alpha-Q, G-alpha-0. These are 4 active G proteins. And among this, GQ is binding to 69 leukotriene receptors and increase the action of leukotrienes. Excess action of leukotriene on the lungs increases bronchial constriction as well as inflammation in the bronchioles, may lead to asthma. Leukotrienes induced asthma. So the simple answer for this MCQ is it is coupling to one of the active gibberellin, GQ nothing but G-alpha-Q. This coupling to G-alpha-Q or activation of G-alpha-Q increasing IP3 DAG levels, increasing calcium, and here it increases the leukotrienes production. So this is discussion. So cis-9 leukotriene receptors are belongs to G protein couple receptors. Next, find out the correct statement regarding assertion and reason. Methotrexate is a serotonin type 2A or 2C antagonist, and reason it is not used now because it causes abdominal and pulmonary endocardial fibrosis. Yes, both A and R are correct, and R is the correct explanation of A. Because nowadays it is not using because of this drawback. Answer is option A. Both A and R correct, and R is correct explanation for the A. Next, which of the following is a pyrazolone derivative? Mefenamic acid, indomethacin, phenylbutazone, tenazepam. Simple answer. Phenylbutazone is a pyrazolone derivative. Pyrazolone derivative. Answer is option C. So this is the classification of NSAIDs along with their select action on COX enzymes and also based on their chemical classification. Okay. Next one. So diclofenac is preferred in arthritis because of accumulates in the synovial fluid, inhibit the prostaglandin synthesis, it causes severe Ray's syndrome, it reduces neutrophil chemotaxis. Okay, so generally you can observe it does not cause Ray's syndrome. So Ray's syndrome is an adverse effect or side effect of aspirin, excess usage of aspirin. So PQS is correct. It accumulates in the synovial fluid, S. It inhibits the prostaglandin synthesis, S. And it reduces neutrophil chemotaxis, reduce the involvement of neutrophils in the inflammation and reduce the progression of inflammation. So answer is simply option A. It does not involve in production of Ray's syndrome. Ray's syndrome is an adverse effect produced by the aspirin excess usage or overdose of aspirin. So this is a discussion of this MCQ. Next. So which para-aminophenol derivative is associated with analgesic nephropathy? Associated with the analgesic nephropathy. So this drawback is associated with phenacetin. So phenacetin is a para-aminophenol derivative and paracetamol also para-aminophenol derivative. Paracetamol is also known as chemically acetaminophen. So analgesic nephropathy is a drawback in case of phenacetin, chemically para-aminophenol. Para-aminophenol. This is the explanation. Generally, paracetamol is regarded as the safest NSAID. Even for the fever purpose in the pregnant women also, paracetamol is preferred because of its safetiness. And next MCQ. Which statement about the mechanism of action of nephopalm is true? Inhibit the prostaglandin synthesis, block the opioid receptor, does not inhibit the prostaglandin synthesis, inhibit the COX-2 selectively. Okay, generally it does not involving action on prostaglandin synthesis. Which statement about the mechanism of nephopalm is true? It does not inhibit the prostaglandin synthesis. It comes under the category of NSAIDs. So answer is very simple. Option C is the answer. And this is a discussion regarding it is a non-opioid analgesic which does not inhibit prostaglandin synthesis. Next question. So match the condition with the drug of choice. Osteoarthritis, gout or rheumatoid arthritis, anaphylactic reaction to NSAIDs as well as pediatric patients. Generally, regarding the pediatric patient, the safe one will goes to the paracetamol. And aspirin, gout or rheumatoid arthritis will be the aspirin. And anaphylactic reactions to NSAIDs will be goes to this one. And osteoarthritis also. Just a minute. So here you can see, so P, osteoarthritis is paracetamol. There is a conflict here regarding this MCQ. So leave it. We will have a discussion. And definitely, once I have to look that MCQ, there is some conflict is there. Leave it. Next. Which drug is classified as a beta lymphocyte depleting biological agent? Abtacept, rituximab, anakinra, cyclosporin. Generally, all these are comes under the category of drugs helps in the treatment of rheumatoid arthritis with the different mechanisms. And rituximab is a drug classified as a beta lymphocyte depleting biological agent. Beta lymphocyte depleting biological agent. So answer is option B. So this is a classification of drugs helps in treatment of rheumatoid arthritis as an anti-rheumatoid drugs, also known as disease modifying anti-rheumatoid arthritis drugs. Next MCQ. Which of the following statement regarding azathioprine is correct? Inhibit the dihydrofolate reductase enzyme directly. It is converted in the body to 6-thioguanine. It is used only when methotrexate fails and cannot be combined with corticosteroids. It increases inflammatory cytokine production. So which one is correct regarding the azathioprine? Generally, azathioprine is a prodrug, converts to active drug in the body to 6-thioguanine. The 6-thioguanine also having anti-cancer property. And methotrexate is a drug, inhibit dihydrofolate reductase enzyme, and methotrexate is also anti-cancer drug. So this is the discussion regarding azathioprine. It is active drug converts to 6-thioguanine. And azathioprine having immunosuppressant activity. Immunosuppressants are helps in the treatment of organ transplantation as well as the autoimmune diseases. And going to the next MCQ. Here, two statements are given. One is labeled as assertion and second one is the reason. Second generation antihistaminic drugs are more beneficial compared to first generation antihistaminic drugs. Second generation do not give CNS depressant property. Simple logic. So second generation H1 receptor blockers are safer than the first generation because second generation cannot cross blood-brain barrier, so no sedation. But first generation can cross the blood-brain barrier, can cause sedation, drowsiness. The simple is both A are correct. Nothing matter. A and R are correct. R is correct explanation. Okay, that's very clear. Next. So if you want to see the explanation, just I am passing here. A small pause. Next question. Regarding the next question, which of the following drug mechanism pair is incorrect? Methotrexate, dihydrofolate reductase inhibitor with anti-cytokine effect. Yes. Azathioprine converted to 6-thioguanine, suppress the T and B cells, T lymphocyte, B lymphocytes. Leflunomide, monoclonal antibody targeting TNF. And cyclophosphamide, cytotoxic agent reserved for the severe diseases. So leflunomide is not a monoclonal antibody targeting TNF drug. Leflunomide is also comes under the anti-rheumatoid arthritis drug. So wrong one is option C. Remaining A, B, C are correct options along with their mechanism of actions. So here these are the all list of immunosuppressants. Immunosuppressants helps in the treatment of rheumatoid arthritis because rheumatoid arthritis is an autoimmune disease where our own immune system produce the antibodies and damage the synovial joints. That's why to suppress excess functioning of immune system or over antibodies production, immunosuppressant should be used. Help in treatment of rheumatoid arthritis. Next question. Which of the following best explains the mechanism of action of hydroxychloroquine in rheumatoid arthritis? Chloroquine is an antimalarial drug, helps in treatment of malaria. Hydroxychloroquine helps in treatment of rheumatoid arthritis. So decreases leukotriene synthesis by COX-2 inhibition? No. Lysosomal stabilization and free radical scavenging? Yes, that is correct. Blocks JAK-STAT pathway? That is not correct. Direct B cell anti-proliferative effect. So option B is the correct. Stabilize the lysosomes and also involves in the scavenging of the free radicals. That is the mechanism of hydroxychloroquine in the treatment of rheumatoid arthritis. Option B is the correct answer. Option B is the correct answer. Next. Red spot in the triple response is caused by afferent nerve activation, intense capillary dilation, plasma exudation, arteriolar dilation via axon reflex. Because of intense capillary dilation, there is a red spot. When histamine is injected, there is a red spot flare will are observed. So, due to excess vasodilation, blood flow increases to end part of the body like skin as well as fingers. That leads to redness, flushing. Answer is very simply that is intense capillary dilation producing red spot. The redness is because of more amount of blood flow to the end part of the body like skin as well as the fingers. So this is the explanation regarding this MCQ. Next one. Which enzymatic pathway leads to prostaglandin and thromboxane synthesis? Cyclooxygenase, lipoxygenase, P450 monooxygenase, monoamino oxidase pathway. So COX enzyme. Cyclooxygenase 1, 2, like 3 types of enzymes are there. So cyclooxygenase pathway helps in the synthesis of both thromboxane as well as prostaglandins. Lipoxygenase enzyme helps in the synthesis of leukotrienes with help of 5-lipoxygenase enzyme. Answer is very clear. COX helps in biosynthesis of prostaglandins, thromboxanes. Lipoxygenase helps in the biosynthesis of leukotrienes. So this is a pathway how prostaglandins, leukotrienes, all these are biosynthesis through this pathway. And precursor is the arachidonic acid from the phospholipids. Next. Which of the following statements are correct? COX-1 is constitutive. COX-2 induction occurs during inflammation. COX-3 primarily regulates pain and fever. COX-3 inhibition produces strong anti-inflammatory effect. So COX-3 inhibition helps in treatment of fever, but COX-3 inhibition does not interlink with the anti-inflammatory effect. So COX-3 primarily regulates pain fever. Yes, that's why paracetamol inhibiting COX-3 helps in treatment of pain and fever. COX-2 inducible, its concentration increased in inflammation and pain. And COX-1 is constitutive in the GIT, protect from the ulcer formation, prevents ulcers in the GIT with help of COX-1 prostaglandins. So answer is very clear. Option S. Nothing but here in this PQRS, S is wrong. So simply PQR are correct according to this question. So this is explanation again with COX-1, COX-2, COX-3. Basics are very, very essential. So please go through explanations while you listening again this video or going through this video again. Sorry. So colchicine. Colchicine is a very good drug. So colchicine, 𝘖𝙀𝙎𝘾𝙐𝙎. 𝘖𝙀𝙎𝙎 is act to the central nervous system mainly to control spasms of spinal cord or severe back pains, backache. Anyway, so colchicine inhibits inflammation by blocking which cellular structure? Golgi apparatus, cell membrane, calcium pump, microtubules of mitotic spindles, and ryanodine receptor. Simply, colchicine is a drug, helps in treatment of gout by interfering with microtubules function, stops the cell division of inflammatory mediators which may progress the inflammation in gouty arthritis. Answer is simply option C. Colchicine mechanism is option C. As you know that colchicine from the Colchicum autumnale, natural source, belong to the family Liliaceae. It containing circular stomata. Next. Which of the following explains uricase therapy such as pegloticase can rapidly reduce plasma uric acid levels? So pegloticase, one of the drug, helps in the treatment of gout by rapid inhibition of xanthine oxidase, immediate conversion of uric acid into highly soluble metabolite, increased tubular secretion of uric acid, blockade of purine biosynthesis. So pegloticase is an enzymatic preparation. It causes conversion of uric acid into soluble metabolite. The soluble are polar in nature, polar substance easily excrete through the urine and reduces uric acid levels in the blood. That helps in treatment of gout and controls the symptoms. Okay, the answer is very clear. That is option B. And this is a discussion regarding pegloticase. It is a recombinant uricase enzyme. Oxidizes uric acid to highly soluble allantoin. That allantoin is water soluble, excrete through the urine easily and leads to reduction in the uric acid levels in the blood. And last MCQ of our discussion, bromhexane produces mucolysis by inhibiting mucin synthesis, opening sulfhydryl groups only, depolymerizing mucopolysaccharides and releasing lysosomal enzymes, blocking a cuff center in the medulla. So simple answer, it make the thick mucus to thin mucus and help in treatment of cough by depolymerizing mucopolysaccharides and releasing lysosomal enzymes. These lysosomal enzymes break down thick mucus to simple thin mucus to easily eliminate from the throat. Okay, the answer is very clear. Option C is the answer for bromhexane. So this is the explanation of bromhexane. I hope you got your answers. I hope your preparation is going fine and continue your preparation. The time is also going fast. Now it is already November ending also. Still maybe around 4 to 5 months will be there. So continue your preparation. All the best. Subscribe to GDC English classes and share our GDC classes information to your friends regarding GPAT, NIPER, drug inspector and pharmacist coaching. Thanks for watching.